Hey, Bob here. It's Sunday, November 2nd, Sunday morning, early. And once again, I just started a video and for some reason it paused on me. So I have no idea why. But I'll start this video again. 2025, November 2nd, Sunday morning. And it's just gorgeous here at Lake Louisa State Park. So I came over to clear my mind. I went to see my neurosurgeon because I had an MRI because of vision loss in my right eye. And the MRI showed that I had a mass which was pressing against my optic nerve, my right optic nerve, and causing my right eye to slowly go blind. And that's where I am right now. I've been misdiagnosed by, I think, 3 different doctors, and I wasted a lot of time with them. And I had a couple of leg injuries this year. One of them was pretty tough, and it took about 5 to 6 weeks to get back on my feet. So I had a lot of interruptions, and I was, I don't want to say neglecting my right eye problem, but I didn't think it was serious. I thought that they could do some kind of Lasix on my cornea because that was my issue. Last May of 2024, I had a anterior basement membrane dystrophy, which I was diagnosed with. A beautiful tree right there. And the ophthalmologist, 3 different ones that I went to, decided that that was my problem, and nobody ever looked further until Dr. Kraut, who is a retina specialist. He saw some stuff in some tests about 4 months ago, and he said, you don't have a cornea problem. Your cornea is fine, your right cornea. You have an optic nerve problem, and I want you to go get some special testing, and you might need an MRI. So eventually that all happened. I had an MRI finally after seeing a couple of other doctors that he recommended, that Dr. Kraut recommended. And I saw these doctors, and essentially the MRI revealed that I have a mass behind my eyes in the front cavity of my skull. And it's this mass, it is benign, so it's not cancerous, but yet it's still there. It's a slow growing meningioma, something like that. And it's pressing on my right optic nerve, causing my right eye to go blind. So my left eye sees perfect right now, but my right eye is only seeing about 20%. And so I have this mass, and it needs to be removed. If I don't have it removed, I will go blind. I also noticed, looking at the film with Dr. Mel Fields the other day, I noticed that this mass is only millimeters, a millimeter or 2 or 3 or whatever, I couldn't tell exactly, but it's awfully close to my good optic nerve. So, pretty scary stuff. Dr. Field gave me a couple of options for surgery, But really, the only option that he does is he cuts you from ear to ear, top of your head. He makes an incision in your scalp from ear to ear. Then he pulls your scalp down over your forehead. Sorry about the goriness. And he cuts a hole in your skull, right in the front here. He told me the hole's about this big, so I'm not sure. It looks like about an inch, maybe an inch hole. And he takes the bone out, and they go in with their instruments, and they put it's kind of like, I get the impression that it's like a very small vacuum, and they stick this vacuum tube into the tumor, and they slowly start sucking it out of there. That's how he explained it to me. And unfortunately, the tumor adheres itself to whatever it's up against, and the surgeon has to be very, very careful, because it's pressing on my optic nerves. My carotid arteries are right there too, as well as my pituitary gland. It's all right there in the front. And he has to be sure that he has to try to get it all, but he can't always get it all. He said it's like pouring Elmer's glue in there, and it's like kind of cobwebs itself and sticks, the tumor sticks to whatever it's, attaching to. So he tries to get it all. And he said that he usually does get it all, but there are a lot of risks involved, and you just don't know. So whatever he doesn't get, you might have to radiate after weeks and weeks after the surgery, after you recover. So this is by no means a, go in there and fix it and it's all done and everything's going to be honky-dory. They literally have to slice from ear to ear, pull the skin over my forehead, drill a hole somewhere, take out the bone, go in with their instruments, get rid of the tumor, put the bone back in. They have a way of screwing it in place with some tiny little titanium-like eyeglass screws that you'd use in your eyeglasses. And then, of course, the bone grows back, and then they pull your skin back and stitch you up. You do end up with a big scar here from ear to ear. So that's not cool, and I have no hair to hide it. So I'm going to end up with a scar, and I will have to wear, for my own vanity and not to freak anybody out, except for on Halloween, I'll be wearing a hat from this point on. I'm 71 years old. There are some complications. You can have a stroke. It's very small. It's like 1% risk. And this whole procedure has a success rate of about 95%. So that's pretty darn good. And hopefully I'll be on the good side this time. But anyway, that's what's going on with me. It's scary stuff. And talking about it helps. I am losing sight in this eye, And seems like the longer I go, the more sight I lose. Now, there's a possibility that I might get some of that sight back in this eye. Some patients get it all back, and some patients don't. I'm hoping that nothing happens to my good eye, my left eye, which right now is seeing perfect. So I was sitting in the chair watching the final game of the World Series last night, and I was thinking to myself, you know, the usual thoughts: why me? Age 71, I didn't really need this right now. We were in the process of buying a new house, which we would have closed on 4 days ago, and we decided to pull out of it. And I felt, as I mentioned in previous video, I felt terrible for the people whose house we bought. We lost $1,000 deposit plus the just about $700 for the property inspection. We just didn't feel like we could deal with moving into a new home right now. So we decided to stay put for now in the home that we love and we've owned for 37 years. 37 years is a long time, and we feel very comfortable there. But on the same token, we were looking forward to moving. Something new, something fun, different, exciting. It's a beautiful house, maintenance free. So anyway, just to finish up this video, because it's different from my last video that I talked about this. Now I've seen the tumor with my own eyes. I know where it is. I know the risks. I've met the surgeon. Honestly, I would have this done today if I could. Despite the scar that will be on top of my head. You know, that can be hidden with a hat. And I want to get this mass out of there and get this over with. I've been assured that pretty much this isn't something that's going to kill me. But, you know, medical science is not an exact game. So who knows? I noticed I have a hiker in front of me, so I'm just going to give him some time to, I don't want to bother him. So yeah, here I am, and it's a beautiful day here in Florida. I'm on a trail that I don't do that much, but I like it. And I think I'll do another trail after this one. I'm feeling pretty good. I'm going to stop at the storage unit on the way home to my house in Dr. Phillips. And of course, we have a storage unit in Claremont where we were moving a lot of our stuff in preparation for our move. But now I'm going through that storage unit, and I've got to get some of our Christmas stuff and move it back. We may be setting up a Christmas tree today. We've got 3 Christmas trees we set up now. So anyway, that's about it. That's the important stuff. Of course, the surgeon, Dr. Field, is going away for 2 weeks in November. So I'm happy for him. He needs to get away, but it doesn't help me any. I'd love to get this taken care of ASAP so that I can use 2026 to heal. I'm hoping I get some eyesight back, and I'm also hoping that I don't lose anymore, and especially with my good eye. Taking a risk. He also told me that if I didn't do anything, I would go blind eventually. So that's not a great option. Now this guy in front of me seems to be taking photos with his cell phone, and I can't blame him. He's on the move again. I'm gonna wait a minute or two for him. Yeah, that's about it, and just wanted to get that off my chest. It's not great news, but at least I know what I'm dealing with now. I've gone to these different ophthalmologists who never even contemplated that something else might be going on, that it wasn't, perhaps it isn't your cornea, Bob, maybe something else is going on. And doctor number 3 that I went to was Dr. Gulani, and he's a bit of an odd guy, but I won't go into all the things about him, but he did say to me he saw a couple of things that he wanted my retina doctor to look at, to rule out macular degeneration, and also to check my optic nerve, blood flow, all this. He did, Dr. Gulani, despite the fact that he's cash only and he's full of himself and he's quite a character, he did see a couple of things that made us go to Dr. Kraut. Dr. Kraut is our retina guy. He's in Ocoee, which is a short distance from my house. And he's the one who said, Bob, I see some stuff that I don't like, and I want you to go see these 2 other doctors, and you might need an MRI. And so my hat is off to Dr. Kraut. Dr. Kraut was the guy who got me into the right hands, diagnosed, maybe you'll need an MRI. And the MRI is what is going to save me in the end. And of course, having this brain surgery isn't any fun to look forward to, but I just want to get it over with. So anyway, that's my story. And all other things have been put on hold until I get through this. Other things meaning any creativity out of me. No songwriting for a while, no guitar making. I'm just going through some of my boxes that I moved over to the storage unit, and I'm throwing away more stuff, refining what I keep and what I get rid of. That's where I'm at right now. So wish me luck. I feel great. I see great with one eye at the moment. I'm grateful that I'm alive and walking, because I did have some leg problems this year. And that's, for the most part, all healed. And I'm living with the right meniscus tear, but it's not bothering me at this point. So I keep moving forward. It's a beautiful trail here. I don't know if you can see it in the background. Beautiful day. So much to be grateful for. And I have to go see my cardiologist is taking personal time off, so I have to go see his assistant on Tuesday. I need to get cleared for surgery. And he's been wanting to do an MRI on me for a long time. And I kept saying, no, I don't need an MRI, I'm fine. Well, he's going to get his way now, because I'm sure he's going to have me do a stress test. Not an MRI, excuse me. He's been wanting to do a stress test for a long time, and I didn't want to do another one. I don't like them. but now I'll do it. And he might also prescribe an echocardiogram. So whatever I have to do to get cleared for surgery. And then whenever Dr. Field can fit me in. Seems like it might be in, you know, the first or second week of December. But I really don't know. We're going through all the stuff right now. Okay, Bob checking out. God bless you all. And try to stay in good health. Keep moving. Don't eat too much. And hopefully after this is over, I'll be filling you all in on how it went. Okay. Bob checking out. Take care now.